Have you ever second-guessed what you're hearing through a stethoscope? My colleagues at Echo Health have created a 21st century stethoscope to help you confidently detect heart and lung conditions. With Echo, you can hear more precisely with amazing amplification, noise cancellation, and even Bluetooth compatibility. You'll detect murmurs more readily, record and share what you hear with colleagues, and visualize heart rhythm data right on the device. Echo's backed by 4 million heart sounds and FDA-approved AI that analyzes while you listen and will make you 2 times more likely to detect heart disease. Right now, you can get $50 off plus a free customizable chest piece cover at echohealth.com/Keith. Plus, Echo guarantees you'll detect heart and lung conditions more confidently. And if you don't, you can return it for a full refund. Go to echohealth.com/Keith for $50 off plus a free chest piece cover. That's ekohealth.com/Keith.
But if it all works to improve the patient outcomes, drives efficiency, and really overall provides quality care and reduces overall cost of care, now value-based care can give you the opportunity to actually do that work, which makes sense, and achieve and sustain financial sustainability in your practice. So it's a different model.
What's most exciting about the possibilities for the nurse practitioner workforce within the context of the new paradigms of care emerging at this point in healthcare history? Let's talk all about it with Angela Patterson, the Chief Nursing Officer at CVS Health, right here on episode 521 of The Nurse Keith Show. Hey there, this is Nurse Keith. As always, this podcast is about you. It's about your personal and professional development, your career, and the healthcare system writ large. And I'm here to share education, ideas, and informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, medicine, entrepreneurship, and beyond. I love having you along for the ride, and I thank you from the bottom of my nurse podcaster's heart for being part of the growing Nurse Keith Nation. If you'd like to help other people find the show, you can always leave a rating and review on Apple Podcasts. That is super helpful. And if you'd like to become a patron of the show, you can go to Patreon, patreon.com/Nurse Keith. As little as $2 a month helps so much in terms of keeping things rolling here at the Nurse Keith Show, and I appreciate my patrons more than I can possibly say. You can also share the show with anyone who you think might enjoy it or get something out of it. And no matter how you're interacting with us here at the Nurse Keith Show, including listening right now like you happen to be doing, thanks for being here. The show notes with all the links we mentioned will be at nursekeith.com in the drop-down menu labeled podcasts, and they'll also be in the app where you're listening on your smartphone or whatever device you use to check in and listen to podcasts. And as I said today, we're here with Angela Patterson. She is the Chief Nursing Officer at CVS Health. And Angela, it's an honor and privilege to have you here. And I wanted to start with this first question. How do you feel that this kind of like new paradigm of retail-based healthcare, especially where nurse practitioners are driving the car, how do you feel like this came about? Like, where was this all born from?
Hi, Keith. Thank you so much for having me. The concept of retail health actually this year is celebrating its 25th year anniversary, which is quite amazing. And it really came out of a small group of providers and business folks, which included a nurse practitioner, who at the time were looking to understand how best to improve the experience of the healthcare consumer. So if you think about, it's kind of hard to think about 25 years ago, a lot of industries like music and retail were changing the way that they were approaching the consumer and really thinking about what were the needs and desires of the consumer in receiving the services, and how do we use technology and other resources and assets to improve that consumer experience. And retail health was really about looking at patients as healthcare consumers and thinking about how do we address those pain points. And at that time, which isn't much different than today, the pain points that healthcare consumers shared were things including access, convenience, cost, certainly quality, that same conundrum that we talk about today. So retail health really sought to create a novel healthcare delivery system that was in the community, really filled that gap between primary care and the emergency room, which at that time was a very large gap, and really sought to offer convenient, high quality care that was accessible, affordable, and really fill that gap to support patients when they didn't have a primary care or couldn't get in to see their primary care. Maybe they were traveling, didn't have one, and higher cost care settings like an ER. And it was really born in Minneapolis, St. Paul, where a kiosk version was released inside of a grocery store. And one of the things that really excited me was that the nurse practitioner, the APP, was really identified as the provider of choice for this model, in part because what we also heard from healthcare consumers was that in addition to access and convenience and affordability, they were also looking for more education, more advocacy, and a more relational experience, things that the profession of nursing has long since been known for. And so this model originated and then started to grow and build in the 2000s. With nurse practitioners and PAs being at the forefront of care delivery, being at the face of care delivery, and really expanded. And it was not easy. There was a lot of concern, a lot of pushback from lots of organizations and systems about, was this high quality care? I mean, these are not physicians delivering the care directly. They're in non-traditional healthcare settings. Could this pose a public health concern? And so on. So it was really an exciting time. And when I joined at that, early in the evolution of retail health, I mean, coming from primary care, I did not know whether this was going to be successful. I knew how difficult it is to run an ambulatory care practice, and margins are very thin, and there's a lot that goes into it. But the reason why I took a chance in changing the direction of my professional journey was that I believed that it would really be instrumental in having us all think differently about how healthcare could be delivered, something that I saw in my prior years as I did medical mission trips, the way healthcare was delivered in other places in other countries. And the other thing that I felt really confident in was that it would also increase awareness as to the practice and the work and the contributions of nurse practitioners in care delivery. And I've also, over the course of these many years in this work, I'm very excited to see the increasing importance and impact and role and work that nurse practitioners are doing to advance community-based healthcare delivery.
Absolutely. Yeah, well said. And, it's obvious at this juncture in 2025 that nurse practitioners have gained ground. You stop anybody on the street, and a large proportion of people, I think now, compared to, say, the year 2000, if you ask them what a nurse practitioner is, they might actually know. Or they'll say, oh, I see a nurse practitioner, or my wife has a nurse practitioner she sees, et cetera, et cetera. So I think nurse practitioner has become, there are still people, I think there's still some trust issues in certain segments of the population. But I think in general, NPs have gained a lot of ground. And lots of people feel comfortable and have seen boots on the ground that they get really good care, and that there's literally no difference between the care they get from an NP and an MD. Now, we all know there's There are states where NPs can't practice independently, et cetera, et cetera. And, that's all going to keep morphing as the time goes by. But still, the advances aren't going to go backwards at this point. And what you're doing, at CVS Health is contributing, and we'll get to that too. We'll get to some of the details of what's happening there. But from your perspective, I mean, you have your doctor of nursing practice, you've been around the block, you've been at P for a while. You personally, like, what makes you really happy and feel, like that sense of satisfaction to see that NPs are gaining ground? Like, how does that manifest for you just as a professional and as a person and as a nurse? What does that bring up for you when you think about where NPs are now compared to 1995, for instance?
Yeah, just an incredible sense of pride and inspiration. It is what truly, it's truly my passion and what motivates me to support our profession and the work that we do to improve the health and well-being of our communities. Just by the sheer numbers, I graduated as an NP 37 years ago, and it was a very different landscape, although work that I just saw so much opportunity in. And when I fast forward to today, 30 states having independent practice regulations in place, and just the sheer number of patients that are cared, billions of patients who have been cared for with tremendous quality by nurse practitioners. It's so exciting. And certainly the quality data, as you shared with regards to the quality of work, I know certainly in my organization that the quality performance of our nurse practitioners is really top tier, and our patient satisfaction scores are again best in class. So that's so exciting to me. When I think about even just the numbers, today there are about 430,000 nurse practitioners across our country, and of them, about 80% are committing their work to primary care. I spent 20 years as a primary care provider, co-owner of a family medicine practice that was largely an NP model practice. And I know when I came into this work at Retail Health, I knew the care excellence that NPs can deliver and how they can work together as part of a broader healthcare team to really advance health and well-being and make our communities healthier. And so that has, as I think about this, and I think about certainly the struggles of our healthcare system today, it is still, when I first came into Retail Health 18 years ago, we were talking about this, the looming physician shortage, access issues to primary care. Those issues remain a constant for us, and in some ways, are even more challenging than ever. I really see nurse practitioners as being an important solution to advancing and improving our broader primary care system, together
Right.
with the broader healthcare delivery team. It's a real solution. And, I know myself, access is tremendously difficult. Recently my PCP, a nurse practitioner who I'd been with for years, decided to take another position. And right now I'm in that space of being medically homeless. I'm trying to get another primary care, and it's tough. And I'm going to need to wait months before my first appointment. And when I think about my purpose to really be part of real solutions to improving healthcare access and care and delivery, NPs for me are a central and integral and essential part of that solution.
Yeah, I think you're so right. I totally agree on many, many levels. And when you and I had our first preliminary conversation,
Mm-hmm.
you brought up this concept of value-based care in primary care. And you were saying that that's a different structure than simple like fee-for-service care. So what what is value-based care? Because a lot of people may not have heard of that term, and it is pretty new to me too. And I want to make sure I understand what that actually means.
So, value-based care, we're hearing, it's been discussed in the past, and today, we're hearing more and more about value-based care models in primary care. And what value-based care does is really change the economic model of a healthcare delivery practice. So, for many years, most of us have been functioning in fee for service, which means, we see a patient in the office and we get paid for that visit. Caring for patients, telephonically, or in some cases in a primary care ambulatory practice, being able to do a home visit, like those kinds of things weren't reimbursable under fee for service. And so it really came to a model of economically, you needed to see more patients, see a lot of patients. And it didn't matter in general what the outcomes were. So I could be seeing patients and you could be seeing patients, and I may be doing a better job managing my patients' hypertension and diabetes, keeping them out of the hospital, reducing ER visits, preventing rehospitalizations. And perhaps in your practice, it was less so, but we still in general got paid the same for the same work. With value-based care, the economic model is different in that you work together with payers, and there is a different there's a different fee structure in that patients are evaluated. There may be in full risk models a monthly payment that is delivered to the practice, and based on how well your practice is at hitting certain quality metrics, like ensuring your patients are up to date with their preventative screenings like colonoscopies and mammograms, pap smears, or how well your practice is doing managing patients with diabetes and hypertension. As you increasingly demonstrate through data that you're actually improving those metrics and you're reducing overall costs of care, perhaps your practice has systems and protocols in place that really help to reduce ER visits by patients unnecessarily who could be seen in your practice or handled, telephonically or through a virtual care visit, or preventing hospital readmissions, for example. As you demonstrate mastery in those metrics, delivering high performance in those metrics and outcomes, you actually can augment or share in the savings that result of that excellent care. And so that means that in a value-based practice, and there are different risk arrangement models, there's a lot that goes into it, but in general, what I hope for is that we can care for our patients both with in-person visits, but also be able to have conversations with patients by phone, continue education and advocacy, and do different kinds of things that today can be hard in practices if for financial reasons to pay for that kind of services outside of a standard office visit. But if it all works to improve the patient outcomes, drives efficiency, and really overall provides quality care and reduces overall costs of care, now value-based care can give you the opportunity to actually do that work, which makes sense, and achieve and sustain financial sustainability in your practice. So it's a different model.
Yeah, that's an interesting model, and it makes me think, and I don't want to go down this rabbit hole because we could go down this for like an hour, but I'm reflecting on, like I go see my PCP, who at this point is an MD at this moment in time, not an NP. And, I can't remember the last time she checked to see when my last tetanus shot was, or does she even know when my last colonoscopy was? Or, I honestly can't remember the last time she put a stethoscope on my body. Do you know what I mean? So
Yes.
it's kind of like I can see how if you're looking at the bigger picture and the payer is looking at the big outcomes, not just paying the fee for that specific visit, how that could change things. And, the old days of when a doctor would have time to say, "Oh, let's see when your last tetanus shot was.
Mm-hmm.
Let's look at this. Let's look at that." That doesn't happen much anymore. And well, doesn't happen in my world. But before we take a break and we just have a couple minutes, I wanted to ask you about this paradigm that a lot of NPs face, whether it's in value-based care or fee-for-service, of the 15 to 20-minute visit. And a lot of NPs who call me for coaching, actually, and look to other coaches too, feel that they can't like provide the kind of holistic nursing care that they were trained to do or feel like they were trained to do, because that 15-minute visit feels like they're a square peg being pounded into a round hole. So do you feel that NPs can find the sweet spot of being able to do enough in that 20-minute visit and deliver the kind of care they want to, as long as they stay focused? Like, what are a couple tricks, or how do they have to adjust to that paradigm?
This is near and dear to my heart. I hear
Okay.
the same feedback
Yeah.
consistently, and I absolutely understand. Ian lived it myself, and certainly can empathize it. I think a
Right.
couple of things. I think first and foremost, it is very important that a nursing leadership priority, if you're a nurse leader, this must be a priority, that we must work hard and prioritize work that is needed to improve and make our systems that wrap around our nurses more efficient. If you just look at what's happened in healthcare over, recent years, more administrative work. I nurses talk to me a lot about the work of prior authorizations and referrals and those kinds of things. How EHRs absolutely important and terrific on so many levels, especially connecting care across systems and places of care. But in many ways, it's tethered our nurse practitioners and nurses to the computer. So
Yes.
they're in front of a screen instead of in front of the patient,
Right.
which feels very, very different. Administrative tasks, just the burden and the challenges of everything that our nurse practitioners and nurses now have to do in the course of a day that are not about direct face-to-face patient care. We as nurse leaders must continually press on our systems to drive efficiencies, use technology, AI, digital, EHR enhancements, support colleagues to help untether and remove what I would call the shallow work of
Mm-hmm.
our clinicians. So the deep work is caring for patients. The shallow work is everything, all these administrative pieces. We must look at where the pain points are and invest in and prioritize driving efficiencies to support our nurses and NPs and healthcare providers. I mean, this is a contributor of burnout. And internally, I know for me, just feeling a tremendous hit to my sense of purpose. I went into this line of work to care for patients, to form relationships, to connect, and all of these other pieces. Really, you can lose your spirit in that way. I think on the NP and nurse side, what I would say is a couple of things. One is, it is so important that you share your voice, share what the experience is like as a colleague in that practice, and share how that experience impacts the patient experience with your leadership. Our nurses and NP direct care caregivers are the voice of our patients' stories, and we must be sharing those experiences with others and really being part of the continuous improvement work that must happen within practices and organizations. I think that is really important. Everything that we may think about, like workarounds, think about them as potential innovations for how to make the work easier, better, more efficient, improve quality, improve safety, those pieces there. The other thing I would say is, the other thing that we're contending with as caregivers is that just information in general about our patients is moving at such a rapid space. When I first started as an NP, it took decades for healthcare, the information that we need to take care of our patients to double. Today, that information doubles every 72 days. We as caregivers must upskill every 18 months just to keep up with all of this. So I think one of the things that's really important is to understand why this feels like 15 or 20 minutes isn't enough anymore. When I was practicing primary care 20 years ago, those were my visit lengths as well, under different circumstances. I think it's really important that we form longitudinal relationships with our patients. We've got to focus on any sort of urgent or immediate healthcare needs, and we need to stay connected to our patients. We've got to have this relationship to ensure that we're engaging them, that we're keeping them healthy, that we're keeping them up to date on all those preventative vaccines and screenings and all of those things that we are trained to do. That was one of the first things NPs did, was doing preventative wellness screens and exams for children. And that's in our DNA, that's in our training. So I think forming relationships, prioritizing what we need to get to today. And I did this all the time. I would address what was most essential and say, okay, this is the work we have next to do. We're going to reconnect 3 weeks or 3 months and continue on. And we have to see it in caring for our patients in primary care as it is relational, it is longitudinal. And that is also why, preventing burnout and turnover is so important, because these relationships are so meaningful to our patients. And when it's disrupted, it is felt very deeply. So another leadership priority for us all as nurse leaders is ensuring that we're also prioritizing the well-being, the health, and the engagement of our nurses and NPs on behalf of our patients.
That's so important. And when we come back from the break, I want to talk a little bit about your career, kind of how you've gotten to where you are, and then talk about CVS Health and what you've done there innovatively, because that's really fascinating, and I think well worth spending some time on so people understand what's happening at the company. So when we come back for the second half of the episode 521 of the Nurse Keith Show, we'll continue with Angela Patterson, the Chief Nursing Officer at CVS Health. Are you looking for a fascinating and novel way to empower and elevate your career? My wife, Shada McKenzie, is a gifted traditional astrologer and reader of the tarot with clients around the world, and she offers my listeners a 10% discount on their first consultation. Shada's approach to astrology emphasizes the integration of both modern and traditional techniques as they've been practiced for over 2,000 years, and she brings her sensitivity, life experience, and wisdom to every consult. Shada's work can reveal deep-seated patterns and unlock your potential to live a more meaningful personal and professional life. I and many of my clients have benefited greatly from Shada's mastery of these ancient tools, and if astrology is aligned with your personal belief system, I encourage you to consider reaching out to her at thecircleandthedot.com or email her at Shada, SHADA, at thecircleandthedot.com. Remember to mention the Nurse Keith Show for 10% off your first consultation, and thank you. And welcome back to the second half of the episode. We're here again with friend of the pod and my new friend and colleague, Angela Patterson, and she is the Chief Nursing Officer at CVS Health. Now, Angela, we talked about value-based care. We talked about how the role of the NP has morphed and changed over the last decades. And you've seen that for many, many years. So you've been a boots on the ground NP, but now you're the chief nursing officer at CVS Health. So that's like not a low profile place to be. But I think you started as an RN, correct?
Yes, actually, 40 years ago, last month,
Wow.
I graduated as an RN in the Boston area and went into hospital-based nursing.
Awesome.
And then I always had in my intention to become a nurse practitioner. I had learned about the role and just loved the idea, and so went back to school and became an FNP and practiced for the first 20 years in primary care. I knew that that was my love, my passion. And again, I co-owned a family medicine practice that was staffed mostly with NPs, and we always had students, nursing students, NP students as part of the practice. I also worked in an NP program as adjunct clinical faculty,
Hmm.
had the experience to do medical mission trips abroad, bringing NP and nursing students along with me for that experience. And I thought that this is where I would live out my career.
Sure. And then you went on and got your DNP.
I did my DNP, yes. So when I joined CVS Health a little over 18 years ago to be part of the team to stand up this retail health
Mm-hmm.
practice, and my specific focus was really around the workforce. So retention, recruitment, retention, building out the professional development, the clinical education, as well as helping to lead our quality and safety program and clinical program. I was deeply embedded in that work for many, many years. I was on the East Coast working on expanding the practice across the East Coast, and then moved out to the West Coast for a few years to do the same there. And then came back to the East Coast to take on the position of Chief Nurse Practitioner Officer for Retail Health. And then about last year in 2024, moved into the role of Enterprise Chief Nursing Officer for CVS Health, which is
Wow.
just a huge honor and a
Yeah.
privilege. Mm-hmm.
Yeah. It's wonderful seeing nurses in the C-suite. We could have a whole conversation about the paradigm of nurses gaining ground in the C-suite. And it's wonderful CVS has you in this position. I think it's great that position even exists at large, really, really large companies. I think it's great to see that. So I'm curious, I think what I believe is there 18,000 nurses at CVS Health?
Yes, there's about 18,000 nurses. So we
That's a
have,
big workforce.
it is, and it's nurses as well as nurse
Practitioners.
practitioners. We have our nursing workforce uh, is within just a number of such important roles. Certainly in direct care delivery, in our healthcare delivery practices, Oak Street Health, which is a value-based primary care practice for seniors, across retail health, which we are in about 30 states, about 900 physical locations staffed by nurse practitioners and PAs and nurses.
900. Wow.
Yes, we also have a MinuteClinic virtual practice,
Mm-hmm.
which expands across most states in this country, and care led by nurse practitioners as part of a broader team. We work together and collaboratively with our physician colleagues and our pharmacists and our healthcare professional support colleagues, and so it's really terrific. And then Aetna is part of the CVS Health Enterprise. We have a lot of nurses who are supporting care management, utilization management. We have nurses and NPs in quality, developing clinical care guidelines, education, training. just a number, in nurse leadership, managers, directors. So we have many nurses who are in leadership and in administrative positions. And to me, not only the breadth of opportunities across CVS Health for nurses to grow and advance their career, the things that, as I'm in the role of enterprise CNO, that make me so proud, not only of the tremendous care delivery that all of our nurses contribute to achieving the purpose of our enterprise, but the commitment. And one of the things, and I've been with CVS Health for over 18 years, one of the key things that keeps me there for so long certainly is their commitment to our purpose, to advance health and well-being. And this was really solidified for me about a decade ago when they made the decision to remove tobacco from their stores. I mean, to me, personally and professionally, that really meant something as a healthcare provider. And taking that stand, knowing how much of a hit that would be on the economic side, was something that I was very, very proud of. And so I'm deeply committed to expanding and delivering our work to improve health and well-being, utilizing all of our resources and assets to do so. The other piece is the organization. There's a deep commitment to its workforce. And in my vertical, it's the nursing workforce, whether it's educational benefits, leadership development programs, trainings, courses, mentorship programs, precepting students, precepting NPs and RNs within our various locations, something that really speaks to me and I'm deeply committed to. And the work that we as leaders must prioritize to advance our culture. So it's not, when I talk about work that I do to build a culture of nursing practice excellence, to build a community of nurses, to work together with other nursing leaders to build programs and initiatives and have things in place that advance the recruitment, the retention, the resilience, the recognition of our nursing communities. And that is center of the desk leadership priority work. To me, that is extremely meaningful, that we invest in, we measure engagement, we share that, we develop action plans. I mean, a leadership that truly listens to its workforce and works very hard to ensure that all of our colleagues have a quality experience within our organization, including the ability to grow and develop their career, to me is so meaningful. And a very important reason why I am deeply committed to the work we're doing and have been here for these many, many years.
Long time. Yeah, that's great to hear. So you've got NPs working in the retail settings, right? You're providing primary care and / urgent care in the MinuteClinics, right? And I think I told you when you and I chatted a couple months ago that my former chiropractor here in town, his favorite provider in all of Santa Fe is a nurse practitioner at one of the CVS clinics in Santa Fe.
How wonderful to hear.
He really feels like she's the best provider in the entire city. So I wanted to remind you that you and I had talked about that when you and I first chatted. So that's
amazing.
Yeah.
They are so deeply committed to our purpose.
Yeah, and he has sung her praises for many years. So anyway, just wanted to mention that. So, you've got NPs like the one my chiropractor loves so much at the MinuteClinics. Then you have Aetna, which I forgot was part of CVS Health. You and I had talked about that. And then Oak Street Health, which I'd never heard of, which focuses on seniors. So that's a whole nother conversation.
And many NPs in the Oak Street Health practice delivering primary care to seniors and complex patients. Yes.
Yeah. That's really awesome.
And really doing great work to reduce hospital readmissions and improve patient outcomes. It's really a very exciting practice.
And how many states is Oak Street Health in?
I believe they have about 250 locations and yes, and growing.
Okay. Now that we've talked about it, I'll probably start hearing about it because it's now in my consciousness. So I have a quick question for you as we start to wind down. What's an initiative that you feel like you've been a part of in terms
Mhm.
of nursing leadership at CVS Health that you feel like is something either cutting edge or that you just feel has kind of really illustrates where nursing leadership can get developed and honed and sharpened and kind of like moved into the future?
Mhm. So I would say that the one thing that I've led and introduced into our organization and led has that I am most proud of, and I think has had many, many terrific ripples as a result,
Mm-hmm.
is years ago within our retail health organization, I stood up a shared leadership council. And this was about, so for myself as a leader, I really ascribe to transformational leadership. And such an important part of this is hearing the voice and the input and the feedback of our nurses and nurse practitioners. And so I worked to stand up a council where, peer nominated folks met with me directly. So it was a direct line to senior leadership. And it was about, initially, we started off just around discussions. Tell me what we're doing well. Tell me what we should be doing more of. And, what are the challenges that you're having? How can we improve things for you and those who you serve? And it really has morphed into a very strong, impactful, influential process by which we recognize and celebrate the voice of our caregiving nurses, and that we use that information as leaders to inform our decisions. So it's truly shared governance, ensuring that having nurses at every level of the organization. It's evolved to develop committees, their focus groups. We've expanded this to do colleague listening roundtables that our VPs host across many business segments across the enterprise. We're seeing, and we are actually prioritizing work in part based on feedback and recommendations and solutions. And to me, this has created such an important culture across the practice that in 2019, we actually were the first organization of our kind to be designated a Pathway to Excellence organization by the ANCC. A
Oh,
huge source of pride
congratulations.
for me. And so for me, what this really demonstrates, not only how important it is to the engagement and the sense of trust and belonging to have bi-directional, open, honest communication with our nurses, with the most senior leaders directly. But for me as a leader, it really brought to life how important the people part of leadership is to being an effective leader. Yes, I have to work on strategic plans and implementation plans and budgets and those pieces, all the operational pieces, which is an important part of executing against business performance. But in healthcare, the other piece is supporting, my job is to support the caregivers who care for our patients. And so their health, their sense of involvement and engagement, especially in a large organization, especially one that's largely virtual. How do we make these connections and create this sense of trust and belonging, have this communication that's really open and honest? That's how we drive engagement, how we drive resilience across our teams. And to me, that work of ensuring that in expanding it, that it really became a listening culture, that the voice of our colleagues is critical, is mission critical, and must be part of the data we use to inform decisions and engage in continuous process improvement. To me, and the ability to have been supported in this work and still am, to me, has been a leadership highlight.
That's really great to hear. I think that kind of transparency and open communication is so important between the workforce and leadership. So That's really good to hear. And we could spend another hour talking about value-based care. We could spend an hour talking about senior health. We could spend an hour just talking about the role of NPs in primary care, but we really have to wind down. And we could go so much further, but I have 4 very quick lightning round questions that I ask all my guests at the end of our conversations. So
Okay.
are you game for a really quick, concise lightning round? Okay.
Sure.
So this has no relation to what we just talked about.
Okay.
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 So we're changing gears. First question is, what's something you've always wanted to learn to do, but you've never had the time or opportunity to explore it? Could be filmmaking, knitting, anything that you've always wanted to do.
Play the piano.
Really?
Mhm.
Oh, wow.
I don't know how to play any musical instruments, and I've
Cool.
always wanted to learn how to play the piano and
Oh,
just haven't gotten there yet. Maybe someday.
my mom was a Juilliard trained
Ah,
concert pianist. So
oh my gosh.
I
So
hear you.
jealous. I
Yeah.
love that.
And I could never play because I lived with a genius, but just saying. Yeah. So that's cool. Okay.
Beautiful.
All right. Second question is, what does a perfect day off look like for you? Like, what do you like to do in your like real downtime?
In my real downtime, there's definitely a piece that's about me. So I love to exercise and do yoga, like do one of my classes, which always helps me to feel good. I always like to do, for me, self care are things like taking my time, listening to music, and doing my nails. And then, or my hair. And then which I'm always rushing around, hardly get done. The other thing is, without a doubt, spending time with my grandchildren.
Oh, that's nice.
It is such a source of joy, pure bliss.
Mm-hmm.
Anytime I can get together with them
And
means so much.
are they local in New England?
I have a 3-year-old grandson and a 9-month-old granddaughter. And then my husband and I have a blended family. So I also have the blessing of sharing grandchildren, and I have a couple more down the street and just like maybe 30 minutes away. So
That's
I'm
nice.
very blessed to have not only to have such a blended family that's expanded those who I
Yeah.
spend my time with and love.
Yeah. My brother lives with his grandchildren in Cambridge. So yeah.
Oh my
So
God.
it's nice. Yeah. Okay. Third question. If you could choose an entirely different career path, like just outside of healthcare, if you had gone in a different direction in your life, what do you think would be one that might really suit you in a whole, like another universe of Angela Patterson? What
Mm-hmm.
might the other path be?
I always wanted to be a teacher,
Huh.
um, like a grade school teacher. And, I chose nursing, and believe me, I would choose nursing again. I would
Me
say
too.
one thing I always wished I had done is join like the theater group in high
Mm-hmm.
school and community theater. I love going to local community plays, and I think I would have really loved that. When I was growing up, my parents are immigrated here from Italy, and they lived through the war, and it was hard. And so we really focused on not work, but like family. And I had chores to do all the time, and so it was a different time.
Mm-hmm.
And I'd never even thought about doing theater, but I think I would have loved to have been part of that in some way.
Yeah.
And I'd give it a try. If I could do it again, I'd absolutely do nursing, but I think I would try to learn to play the piano and try to do some school
I
or
like that.
community theater stuff just to
Yeah.
try it and see,
Yeah.
because
I
I
like
think it's
that.
fun.
That's cool. Okay. Last question. If you were named queen of the world tomorrow and you had ultimate power, you could do anything you wanted to make people's lives better. What would be the first thing you would want to change to make people's lives better around the world? And you could make anything happen.
Okay.
What would be your first choice of making people's lives better?
I think I would instill a hefty dose of empathy and compassion
Yeah.
into what all of us do each and every day.
Yeah. Spoken like a true nurse, I gotta say.
Yeah, isn't it?
Yeah, several people have said something relatively similar, Yeah, if you start there, you can get a lot accomplished if you start with empathy.
I hope so.
Yeah. Well, Angela, this has been great. I'm glad that CVS Health tapped you to lead, to be the chief nursing officer, the enterprise CNO. And I think you're doing great work. You're supporting your nurses, being an enlightened, empowered leader, setting an example for many nurses. And, people can learn more. Of course, people know CVS Health, and I know you all are on Facebook and Instagram and LinkedIn. They can find CVS everywhere, right? And people can connect with you on LinkedIn. We'll have a link to your profile there. And thanks for doing this great work. And 18 years, I'm sure you have quite a few left to go. And I appreciate you reaching out and wanting to be on the show and highlighting your take on kind of where the nursing workforce and where NPs can really lead the charge, at this point in history. So thanks for being here. Thanks for gracing the airwaves.
Thank you, Keith, for all you do as well.
Well, there you have it. Thanks for listening to this episode of the Nurse Keith Show. The show notes will be at nursekeith.com. We'll have links to Angela Patterson's LinkedIn profile, as well as CVS Health at cvshealth.com, on Facebook and on Instagram. If you need personalized holistic career coaching to elevate your nursing career, look no further than Nurse Keith Coaching and nursekeith.com. Mention the show and get 10% off your first coaching package. The Nurse Keith Show is a proud member of the Health Podcast Network at healthpodcastnetwork.com, where you can find all our episodes. And we are produced by the inimitable Rob Johnston of 520R Podcasting. And before we say goodbye, I'll leave you with this quote from Helen Keller: "The best and most beautiful things in the world cannot be seen or even touched. They must be felt with the heart." Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios till next time from beautiful Santa Fe, New Mexico, and Angela Patterson, the Enterprise CNO at CVS Health, saying arrivederci from
Boston,
Massachusetts. All right. Say hi to my family for me, Angela. Thanks to everyone for listening, and we will catch you on the proverbial flip side.